New Hampshire, a state of great diversity. Our 1.2 million people hail from small towns across the state to the more urban communities of southern New Hampshire. Many visit our state as a destination for our rich recreational opportunities, from the White Mountains in the Presidential Range to the seacoast to our lakes, from NASCAR and motorcycle rallies to hiking and the challenges of the Northeast's most severe weather. When one of our residents becomes sick or injured and calls 911, our state's emergency medical services system swings into action. The New Hampshire EMS system is as diverse as the state we serve. About 175 emergency physicians and 600 emergency nurses care for patients and provide medical support for the system from one of 26 acute care hospitals across the state. About 4,200 pre-hospital care providers respond aboard an emergency vehicle on one of the state's 298 licensed services. About half of the response services are first responders and the other half are aboard ambulances. To support and regulate pre-hospital EMS, statewide leadership is provided by the New Hampshire Department of Safety, Division of Fire Standards and Training, Emergency Medical Services.
New Hampshire RSA 153A defines the declaration, policy, and purpose for New Hampshire's EMS and trauma system. Our state statute outlines the basic responsibilities for who needs to be licensed to provide care outside the hospital, for who is responsible for the development and the implementation of New Hampshire's patient care protocols, as well as the basic safety requirements for ambulance transportation, whether career or volunteer, providing care outside the hospital in the state of New Hampshire. Our administrative rules for our EMS units are under SAFC 5900. These rules establish how to accomplish what RSA 153A has defined. For example, if you are required to provide care outside the hospital and required to be licensed, our rules will tell you how to become licensed to provide care. If you are required to take a training program to become certified in order to become licensed, the rules outline how to establish the authority for a course. The rules also specify the required pieces of equipment for EMS units, whether they are functioning at the EMT basic, the EMT intermediate, or the EMT paramedic level, amongst other important items for our day-to-day operations in New Hampshire's EMS and trauma system.
In each of the state's 5 EMS regions, there is at least one medical director who participates in statewide protocol development and the State Medical Control Board. The State Medical Control Board is defined in regulations as being responsible for writing protocols.
Every EMS education program in New Hampshire must have an EMS medical director. New Hampshire training programs are taught by licensed instructor coordinators. Medical direction enhances the quality and the effectiveness of the education delivery. A key benefit to quality improvement is determining the ways to improve outcomes of not only our education programs, but ultimately that of the patients we provide care for. Vital to closing the quality improvement loop is focusing on continuing medical education programs to address the gaps and shortfalls that are identified during a quality improvement review.
While New Hampshire is a small state, one of the biggest challenges for the whole EMS system is to establish a standard of care that accounts for the diversity of the state. New Hampshire may have urban and suburban areas like many other states, but what truly makes us different are the unusual locations that much of our pre-hospital care takes place. Sometimes easy communications and rapid transport of a patient is impossible because of their location. Of the 4,200 EMS providers, many are community-based volunteers, some are part-time on-call personnel, and some are full-time career professionals. They come from many types of organizations ranging from fire service to community volunteer rescue squads and hospital-based services. Of the 4,200 providers, about 300 are emergency medical first responders who have taken a community-based course or training in initial basic life support of about 60 hours. They have a scope of practice limited to treating life-threatening problems such as initial airway management, CPR, AED, and bleeding control. About 2,000 are emergency medical technicians. EMTs are trained in community-based programs to national standards and have completed about 120 hours of training and are certified by the National Registry of EMTs. Their scope of practice includes the full range of basic life support skills from airway management to immobilization of fractures. In addition, EMTs are authorized to assist with medications such as EpiPens, aspirin, and metered-dose inhalers. They are also allowed to use automated external defibrillators, glucometers, and can use rescue airways such as the King airway or combi tube. About 1,200 are certified as EMT intermediates. The EMTI can provide a limited scope of advanced life support skills in addition to BLS. All are nationally certified EMT intermediates and have usually completed a community-based program of about 200 hours. Their scope of practice includes vascular access using IV and intraosseous routes, rescue airways such as the King or combi tube airway, continuous positive airway pressure, automated external defibrillation, first-line ACLS medications such as atropine and epinephrine, and the following medications: nebulized beta agonists, anticholinergics, naloxone, 50% dextrose, and 1 to 1,000 epinephrine for anaphylaxis. About 750 providers are educated to the paramedic level. Paramedics have completed over 1,500 hours of training beyond that of the EMT and provide a scope of practice that includes advanced assessment, advanced airway management including intubation, manual defibrillation, synchronized cardioversion, transcutaneous pacing, advanced pharmacology including analgesia and sedation, and complete ACLS pharmacology. New Hampshire paramedics provide advanced care according to national standards and have extensive standing orders. All levels of pre-hospital care are governed by the protocols developed and approved by the New Hampshire Medical Control Board. These protocols have been developed by a subcommittee based on the latest medical evidence guiding the practice of emergency medicine in pre-hospital care.
New Hampshire RSA 153A5 outlines the Medical Control Board's responsibilities to include approving protocols and procedures to be used by EMS providers under their own license or through medical control. The Medical Control Board has assigned a protocol committee to assist in the development of these protocols. The protocol members include all levels of EMS providers, emergency medicine physicians, emergency department nurses, EMS educators, and pediatric specialists. The subcommittee reviews the most current medical evidence and emergency medical standards in pre-hospital care and submits these changes to the Medical Control Board for approval. Once approved, the Medical Control Board releases protocols on a 2-year cycle. New Hampshire Bureau of EMS and the Medical Control Board constructed the rapid sequence intubation protocols carefully, such that only the most experienced paramedics who have undergone additional rigorous prerequisites are certified to perform this procedure. All the incidences of RSI that are performed are reviewed for appropriateness and adherence to protocol by both the Board of EMS and the Medical Control Board.
The protocols are organized in a BIP format. B means Basic EMT and Emergency Medical First Responder. I means EMT Intermediate, and P means Paramedic. Each protocol represents a continuum of care starting with basic and progressing to appropriate advanced care. Because our state protocols have extensive standing orders, providers rarely call on the radio or phone for consultation or direction unless they really need your help. Medical oversight is usually provided by offline or retrospective quality review and after-action review with the providers. When providers are requesting online direction during an event, it's usually because they really need your help with cases of refusal of care, cases where an unconscious diabetic has been awakened and is refusing, cases where field termination of cardiac arrest is being requested, resolving a protocol conflict such as a main provider looking for direct orders for analgesia or sedation, or cases where they're really unsure about what to do and they really need your advice.
Perhaps the 2 most important things you can do to provide for online medical direction are 1, know your local providers and their capabilities before they call in on the phone or radio, and 2, know the New Hampshire patient care protocols and scope of practice of the different providers, whether they be an EMT basic, intermediate, or paramedic level provider.
Perhaps the 2 most important things you can do to prepare for providing medical control are to know your local providers and their capabilities before they call in, and to know the state protocols and the scope of practice for each of the training levels, basic, intermediate, and paramedic. A good overview of the scope of practice for the various levels is a chart on pages 120 through 125 of the protocol manual. It provides a comparison of the different levels.